As the country prepares to reopen schools, the Minister of State for Health, Senator Olorunnimbe Mamora, says 10% of positive cases of the coronavirus COVID-19 in Nigeria are children and adolescents, with more than half of them in the age bracket of 10 to 18 years. Mamora disclosed this at the Presidential Task Force PTF on COVID-19 briefing in Abuja. News Agency of Nigeria reports that this is even as the PTF coordinator on COVID-19, Dr. Sani Aliyu, explained that schools must put in all safety measures recommended by the PTF before they can reopen. Calling for caution, the minister said it is therefore pertinent at this point to renew the warning of the PTF on the reopening of schools so as not to expose our children to the risk of infection. And on the current figure of COVID-19 cases, he said the total number of positive cases recorded in Nigeria is 55,632 of a total of 433,206 samples tested. The minister further called for synergy between state governments and medical workers in tackling COVID-19 pandemic.
We continue to record low positivity rate, even as the number of samples tested has increased. While this is a cheering development, it will be presumptuous to conclude that the disease is reducing. This is because as of today, not many states are testing. We shall therefore ensure that testing continues in all the states until we reach our daily targets. 10% of the positive cases are children and adolescents, with more than half of them in the age bracket of 10 to 18 years. It is therefore pertinent at this point to renew the warning of the Presidential Task Force on the reopening of schools so as not to expose our children to the risk of infection. Important components on COVID-19 response, such as laboratory testing, home-based care, psychosocial implications of COVID-19, challenges associated with COVID-19 case management were discussed. A critical and important outcome of the meeting was the resolve of the medical directors to complement the efforts of the state governments in the fight against the pandemic. They also stressed the need for continued routine services in order not to erode the gains we have made in other areas of health. This was also underscored in our meeting with the Honorable Commissioners of Health on Tuesday, September 1st, 2020. It is in this regard that a countrywide deployment of community volunteers to intensify contact tracing where possible and active case finding, supported by various partners that are working with us.